Hello, my name is Dr. Caitlin Pring. I'm a GP at the Cardinia Health Pelvic Pain and Endometriosis Clinic. Welcome to this series of 3 short videos in which I'll be talking about the role of the GP in pelvic pain and endometriosis care, and a bit about understanding hormones and periods, and also an introduction to some of the medications we have available for pelvic pain. We hope these sessions will help you make the most out of your visits with your GP wherever you are. At Cardinia Health, we acknowledge the Wadawurrung traditional owners as the custodians of the land on which we live and work. We recognise the rich and cultural heritage and connection to land that they have and acknowledge their traditional health and healing methods. This series of presentations are recorded from Geelong. Geelong was the traditional Wadawurrung name for Geelong, meaning tongue of land. This first video will be a quick rundown on the role of a general practitioner and how they can help manage and coordinate your care, and a little bit about Medicare funding, because we know that people with pelvic pain spend a lot on healthcare, and so understanding how this works can be helpful. If you're watching these videos and you're not a patient of our clinic, we'll chat a bit about how to find a GP and make the most of your GP appointments. So just a quick introduction to what a general practitioner is and how Medicare works, because understanding this can help you maximise what you get out of both. A GP is a medical doctor that works in primary care, which means they work in the community, not in a hospital, generally speaking. It's important to note that GPs are not surgeons, so we often have patients coming through thinking that we can perform keyhole surgeries like laparoscopies and diagnose endometriosis surgically, but that is done by gynecologists within the hospital system. So we're not surgeons, but many GPs will do smaller procedures like implant-on or IUD insertions or skin biopsies and injections. GPs work as private contractors, which means they will generally have private fees, and so they will charge a fee to the patient for an appointment. And if you are Medicare eligible, so Medicare is the government health insurance scheme that will provide a rebate or money back to you after you've paid this fee. And that will be a set amount based on the type of service that you've received. So generally you'll find that there's still an out-of-pocket cost that remains after you get this money back, which is known as the gap payment. Some GPs might do what's known as bulk billing, which means that they accept that rebate amount as the whole amount for their service with no out-of-pocket costs to you. But as I'm sure many of you will have found, the cost of providing services in general practice, particularly the long consults that pelvic pain and endometriosis often need, is much higher than this rebate amount. So I'm sure many of you listening will have found you're generally paying out of pocket for most of your GP appointments. But although these costs can add up, finding a good GP can be hugely beneficial and certainly help save you costs over time. A GP can really help addressing pelvic pain by assessing you, so taking your history, examining you, arranging appropriate investigations, so blood tests, sexual health screening, pelvic ultrasounds, and so on. They can also provide education and give lifestyle and non-medication advice. GPs can obviously prescribe medications that may be helpful. Some GPs may insert implant-ons or intrauterine devices or give injections. And GPs can also arrange referrals. So referrals from a GP are necessary in general to see tertiary specialists like gynecologists or pain specialists. And GPs can also create plans and referrals to allied health members for cheaper care as well, which we'll talk about. But most importantly, a GP is really well placed for continuity of care and providing really holistic care. So your GP can stay across your health over time and bring together information from your varying specialists or allied health practitioners, and also help to manage any other health conditions that you might have, to really think about you as a whole person. So something that many people don't know or think about with pelvic pain is that you might be eligible for a number of plans which can make allied health visits cheaper for you. So if you're seeing a pelvic floor physio or a psychologist, and these plans can allow you to get some money back from Medicare for those sessions as well. These involve completing some paperwork with your regular GP and setting some goals, and your GP can then create referrals to other key team members to access those Medicare rebates. Feel free to pause on this slide and read through the different types of plans here, and chat about it with your GP to see whether you're eligible. Another thing to note about Medicare, that some people may not know about, is that there is a Medicare safety net. We know the cost of managing pelvic pain can be really high, and often in a year you're paying for lots of scans and tests as well as doctor and allied health visits. And so what the safety net does is once you reach a certain amount that you have spent on eligible services within a calendar year, you'll start getting a higher rebate back from Medicare for those services. So you can check out where you're at with your safety net via the Medicare app or online. And essentially you might find that towards the end of the year, when you go to see your specialist or your GP, that you actually get more money back from Medicare for those visits, so you're less out of pocket. So that can be worth thinking about or checking in on towards at the end of the year. And you might find that seeing those specialists is more affordable. Similarly, the PBS, which is the Pharmaceutical Benefits Scheme, which is a scheme that refers to medications which are made cheaper by the government for certain indications. If you are buying a lot of PBS medications during the year, you might also hit the PBS threshold to get these medications cheaper, or even for free if you have a concession card. So as an individual, these safety nets are calculated automatically, but you still might need to, for the PBS safety net, you'll need to register for a safety net card to get those cheaper medications. If you're in a couple or a family, you might also want to consider registering as a family, so you might reach those thresholds sooner. So just recommend looking at the Services Australia website for more details on these. So if you don't already have a good GP involved in your care, one thing you can do is have a look at the website listed here for the current clinics around Australia that have received funding to provide endometriosis and persistent pelvic pain services. And I do just note there are more scheduled to be opened from 2026. So if there's not one in your region now, keep an eye on that website. There might be one coming. Otherwise, having a chat with the receptionist at your local GP clinic, asking which GP might be interested in endometriosis, women's health, pelvic pain, and or which one might suit you and your particular needs. You may want to Google if there's any women's health specific clinics in your area, or clinics that feel appropriate for your unique needs. It can be worthwhile asking friends or any support groups that you're part of if they have recommendations, or asking your healthcare team. So if you're seeing a pelvic health physio or a psychologist or dietitian, asking them if there's any GPs that they routinely work with that they recommend. Once you find a GP, a couple of little tips. Again, check your fees with reception before your appointment so you don't get any surprises about out-of-pocket costs, and so you're ready for that in advance. It's worth writing down a list of questions or things you want to discuss before your appointments, and even bringing those notes in as well, so you can write down what you learn, or ask your GP to give you a summary at the end of the consult, because we know these consults can sometimes be a little bit of information overload, and sometimes you forget by the time you've gotten home. So writing things down is really helpful. We also recommend that you book long appointments, particularly if you've got lots of things you want to discuss or complex history. And it's a good idea to let your GP know at the start of the appointment what you want to cover that day. So you can work through things systematically. And there's nothing worse than getting to the end of your appointment and you haven't actually gotten to the main issue that you wanted to address. And so it can be really helpful to create a priority list with your GP of symptoms or things of concern that you want to unpack together. But just note that often unpacking and managing pelvic pain and all of the associated symptoms often takes many appointments over time. So you might find that you're needing to book in a number of appointments with your GP to really get to understand what's going on for you. And when you see the GP, as I said, ask them what plans or Medicare rebates might be accessible to you. We know that pelvic pain is best managed with a team, a multidisciplinary team, so lots of different expertise. So ask them who else in your region they recommend bringing in to help manage your symptoms. When you see any doctor, whether it's a GP or specialist, it's really worth asking them, the pros and cons of any treatments or medications that they suggest, including side effects and costs, and what the alternatives might be. So you feel really empowered and you're given all the information to make the decision that's right for you. And as I said, if you're being prescribed medications, just checking if they're on the PBS or whether there might be cheaper options available. Ultimately, your GP and any members of your healthcare team should really be supporting you to make the decisions that are right for you. So find a team that you trust and that empower you in your healthcare journey. So that's all for that brief introduction. We recommend moving on to our next educational video, in which we'll discuss periods and hormones to give you a bit of a basis for then moving on to discussing some of the medication options for period pain and pelvic pain in general. Thank you.